Hello and welcome to Unleashed, the show that explores how to thrive as an independent professional. Unleashed is produced by Umbrex, which connects you with the world's top management consultants. And I'm your host, Will Bachman. And I'm so excited to be here today with our guest, Olivia Chioma Elee, who is an alum of Booz Allen and Deloitte, and she worked on fighting the Ebola viral disease, or EVD, in West Africa. Olivia has a master's in public health from Johns Hopkins University, and she's an independent consultant now working across different industries, but she's here today to talk to us about what it was like fighting Ebola in West Africa. Olivia, welcome to the show.
Thanks so much, Will. Great to be here this afternoon.
So how did you end up working fighting Ebola in West Africa? And tell us a little bit about what your role was.
Sure. Well, in some ways, it was a little bit serendipitous. I had been based in London for a period of time, and I was reaching out to my network, just getting to know different people since I was newly based in London. And this woman was really great. She, and this is in the beginning of, it was the end of 2013 going into 2014, and she was British, and she told me that actually there was a team that desperately needed me in Nigeria. And so she put me in touch with this team, and I ended up, it was working alongside WHO, and I ended up moving to Nigeria to work alongside this team. And it was really fascinating because operationally they were focused on vaccine delivery and immunizations, and they needed more operational support, helping streamline that. So I worked with a range of partners and really got to use a lot of my management consulting skills there. And so while I was there, we were watching what was happening across West Africa nearby. So Guinea, Sierra Leone, and Liberia, we're starting to see more and more incidents, more cases, new cases of Ebola. And then Ebola hit Nigeria. And Nigeria is the largest, most populous country on the continent of Africa. And so there's hundreds of millions of people there, whereas in the other countries, it's much smaller. And you've got massive cities like Lagos has over 15 million people there, and that's where Ebola hit. And it was quite something else. So from there, we started, like, all of the work that we did focusing on immediately switched to focusing on Ebola. And we worked with a range of partners, but the work that we focused on from there was ensuring to help stop the spread of this disease as quickly as possible.
So tell me a little bit about, so help anchor me a little bit. So first, tell me what was your role, and who are you actually working for? Were you working for the WHO or a different NGO?
Right. So my work across the pandemic happened in two countries. I was based in Nigeria at first throughout 2014 into 2015. And then in 2015, I moved to Liberia. I was asked to come to Liberia to help because that's where the disease was really ramping up. And maybe I should talk more about that because the caseload there was so much more devastating than in Nigeria. Nigeria was kind of seen as one of the exemplary countries in how they were able to stop the amount of cases at a period of time where it was spreading in neighboring countries. So Nigeria was able to keep it under 50 people, whereas Liberia had thousands of cases. So when I left Nigeria and moved to Liberia, I was working on a CDC-funded project, and that program, rapid response to EVD in West Africa, through strengthening of surveillance systems and disruption of chain transmission. So that's a whole long, convoluted way of saying this was a U.S. government-funded program with a small NGO, a small tech company. And what we were doing was around three main scope of work. It was a large program, but I effectively was a detailed project manager, and the three components surrounded using technology to focus on surveillance. So that included development of an early disease warning system and assisting with contact tracing and doing streamlined data collection. The next bucket of work that I was overseeing was logistics and procurement, and that was through an emergency management and preparedness pillar, where we helped ensure the running of the emergency operating center, which allowed all key stakeholders to report daily on any incidents across the country of Liberia. Also, the needs and concerns that arose from all the different partners that were working together. And of course, moving products from A to Z. So whether it's from the ports to the different areas of the country where different operating centers were located, because there was a total of 16. And you had all of the different partners from around the world that were in Liberia, in Sierra Leone, in Guinea, working together to stop the spread of disease, to break the transmission. So the different types of partners that I worked alongside, just to follow up with that question, was the U.S. Department of Defense, the Centers for Disease Control, the World Health Organization, and CHI, which is Clinton Health Access Initiative.
So tell me a little bit about, this sounds like there was a lot of stuff going on. I'm curious to hear about some of the details here. So maybe let's start with the contact tracing part. So how did that work in practice?
Yeah, that's a great question. So tracing works when you have a system that's in place that allows essentially data collection to take place after people have been tested, right? So you have a case of someone, the main person, has been exposed to the virus or has tested positive to a virus, and then you essentially effectively quarantine this person, and then you find out where they've been over the last several days. So you are collecting information on where they've been, who was there, and putting all of that information into a database. And it can be very simplistic. I mean, I've seen it done with just a piece of paper and pen and a notepad, and then that information is compiled together and put into a database. Or it can be completed into an electronic database, which is much more preferable when you have so many people that have been exposed to a disease. So that's really what contact tracing is. And then you check up on all of those people that the original contact was potentially next to. So potentially had exposed someone else to the virus.
And how did that work in practice in Liberia? Even just the interviewing the person who's been tested, would someone kind of literally be in just that room with them wearing personal protective equipment, or would they call them? How did it practically work to go out and collect that contact tracing information?
Right. No, that's a great question. So that it depended on if that person was already very sick and had clearly been exposed and clearly also had the disease. Then the clinicians would be the ones who were completely protected and in getting that information from the person who has the disease. I mean, thinking about Ebola, it has a very high case fatality rate. So in West Africa during 2014-2016 pandemic, its fatality rate was it was between 60 and 65%. So more than half of the people who contracted Ebola died. So it was considered very virulent. And the period of time from when you contracted it to when you started to present with symptoms and then eventually died was very, very short. It was within less than 3 weeks usually. I mean, it was a very short turnaround. And so if you had potentially been exposed, so for instance, the main person is in a hospital and they're sick, and you know who they've been in contact with. The people who would then go and follow up to the other people, their contacts, depends on how long that they've been in touch with that person. So either a clinician would go, or a community health worker could go and check up and see how this person was doing. And then you would follow up with them for a period of 21 days. So it really depended on how long ago you were in touch with the main contact, and how, and just going from there, touching base with them every day for 3 weeks,
and
to see if they actually did contract the disease.
Yeah, and the situation in Liberia, how was the data being collected? I'm curious. Maybe they've sort of just leapfrog systems. Was there some kind of an app or some kind of phone app that people were using, or was it all paper and pencil? How are you maintaining all this info centrally, and then making sure that someone was in fact dispatched to go check on all these people, and hearing back from the person who checked on them, I found them, I didn't find them? Sounds like a real massive data management, issue.
It really was. And so one of the things that Liberia and the other countries had in West Africa were many different partners, so many different global agencies that moved into these countries to operationally support that kind of work, right? So you could have an agency like UNICEF, United Nations Children's Organization, that could help do contact tracing. That's an example. There were other organizations that were all assisting, because there were so many people that had to be tracked. And then depending on what those results were, you would do different follow-up. So sometimes the follow-up was those people died, right? And so in order to determine that people actually did die of Ebola, there was another agency, for example, that was helping do dead body swabs. And then those swabs were collected and sent to the central laboratories in Liberia. There were 5 specific laboratories across the country that were collecting that kind of information and then sending it to the capital, which is where the Ministry of Health sat, which is where the largest emergency operating center sat, with all of the partners to literally collate that data. So whether it was an app, and one organization could be using an app, another organization could be using paper and pen, and then transferring that information into an online database, just based on the connectivity. So these are certain things that, created such challenges, because you don't have the type of telecommunications connectivity across the country in some parts of West Africa, like Liberia. Whereas here, in the U.S., you can pretty much get reception anywhere. There are parts in the U.S. where there isn't as great connectivity and reception is not as good. But in other parts of the world, like in many parts of Liberia, that's the norm. The connectivity is very poor. So it created challenges being able to get that data and centralize it on a regular, quick, efficient basis.
Now, what about sort of communications out to the public of, we're certainly seeing in the U.S., there's been, shall we say, some mixed messages about the seriousness of the coronavirus and, how important it is to stay home and so forth. What sort of messages were being sent out in Liberia, and how hard was it to convince the population to follow the guidance?
Yes. So because the virus was spreading in different areas, there was a lot of fear initially. And when you have that level of fear and the lack of education in some of the areas that the disease was spreading, it was very difficult to at least initially, to be able to educate people on what to do. So it's not uncommon to see the mixed messaging in the beginning, especially if your country is a novice at dealing with a pandemic. So it's understandable that mixed messaging could first come out, but it's how quickly you recover from that is the most important thing to remember and to focus on. If you have experts that are available on the ground that can help communicate very clearly and strategically what needs to be done, then the population has a much better chance of understanding what they can do to contribute to stopping the transmission of the virus. One of the things also that Liberia really had to deal with was even the ability to communicate to everyone. I mean, there isn't the level of connectivity. You have villages and towns that don't have power. So it's not like you could turn on a TV in every household and see your leaders communicating what should be done and what should not be done. That didn't exist. So a lot of work had to be done on the ground with community health workers and leaders to educate them first, and then to help literally get out information such as billboards or posters or radio adverts where people would be able to actually hear the messaging on what they could do, what they should do if they feel that someone in their family or in their community might be sick. So that was one of the challenges that they had to learn and deal with in the first, I would say, several months of the pandemic.
Mm-hmm. And what was the message that was being sent out? Was it about like isolating, staying home, not going to the market, or what sort of messages was the key communication?
So, sure. So the messaging that was made very clear was, yes, indeed, making sure to wash hands a lot. One of the things that the countries also implemented was the idea of every public space that anyone in these cities or communities was going to be entering would have an enforced temperature check. So you had people at the doors of every building, of every store, of everywhere, every entrance point, doing a temperature scan to see if you had a temperature. And then you also, in order to enter any of these buildings, any of these premises, you had to wash your hands under a stream of bleach water.
Wow.
So, yeah, so that became the norm. Like, if you were entering any building, you were going to rinse your hands with bleach water. And I remember within my first week, the palms of my hands were just peeling from all of the bleach. And I said to myself, this is good. It's important that this is being implemented. But that's in public spaces. So in terms of what was happening in people's homes, just from, studying public health and working on research studies when I was right out of college, I knew that the data showed that changing people's behavior is difficult. It takes time. But reinforcing the messages of the improved potential for changing your behavior was really important. And so there were radio adverts that were being given. You had local leaders showing the community what they were doing and that it was okay to do that as well, to be safe. And that there's also like these cultural norms that all societies have, where when your loved one is not well, you want to take care of them, and you want to be there to prepare them. So it's very hard to watch, especially now here in the U.S., where there are funerals that are not being attended, that people are dying alone in hospitals. It's so heart-wrenching to hear and to understand that. And that's something that has happened around the world. And that was very difficult to know that, especially in Liberia, the families didn't want that. And so they would bury their own. They would cleanse their own bodies. Especially in the beginning, they were burying them. And so it was spreading the virus before people even could get tested to understand that this was sweeping through villages, that this was sweeping through different neighborhoods, because of that fear of, well, not wanting their family, their loved one to die alone.
And what change of behavior eventually did people have to do? Does it mean like if you had someone who was sick with Ebola, they would just stay in a room by themselves and you would not go in and take care of them? Or would people wear like PPE or to go in, or not bury their dead? Or like what kind of change behaviors happened?
So the biggest changes of behavior was when a lot of the international organizations started coming in and literally, so you had your healthcare workers that were coming in locally and from around the world that were literally looking and investigating potential outbreaks. And so when it would be communicated that there was an outbreak in a particular area and that this was spreading, they realized, oh, we have to be careful. We have to understand that this person didn't die of malaria or didn't die of, there's a range of infectious diseases that proliferate sometimes in different times of the year in West Africa, that this was not those diseases, that this was actually something different. And so this is why these clinicians, these healthcare workers are coming in and trying to communicate and let people know that if your loved one is experiencing these types of symptoms, you have to let someone know. You have to alert your local healthcare authorities. So that really helped also change behavior over time. That education.
Yeah, tell me a little bit about the actual building that you were working in. I'm curious to have you paint a picture for us of like the command center. I'm imagining kind of the White House war room or some, like NASA control room or something. But tell us what it actually was like, the place that you were working, and then I'd like to hear about kind of a typical day for you of what you were involved in.
Sure. So, yeah, it was, I definitely wouldn't call it like a NASA war room, but so I would head over to, my building my office was in a renovated building that had been built. It was just a regular office building, if you will. More like tiled floors, an air conditioning unit that was super loud and very spotty internet connections. And so when you're using like Google Docs and Google like everything, if that internet connection is spotty, you just better hope you saved all of your information.
Right.
So I would either start my day off there early, like between 7 and 7:30, and then there were daily meetings at the EOC, the Emergency Operating Center, based in the capital. And that was alongside, that had been built by the team, and that was at the Ministry of Health. So you would drive over there before 8 o'clock, because 8 a.m. every morning, there was a meeting with all of the heads of agencies that were represented to talk about any incidents from the night before, what was going to be accomplished that day, and if there were any new cases, and just literally what needed to be done for the day. And if there were things that were issues between the other organizations, it gave the opportunity for other organizations present to address it or to be able to help provide potential solutions for that hour meeting every day. And that room, that building was, I guess the best way to explain it is, I'm trying to think. It was very basic. I'll say that. It's like it would, all these cars, all these like these SUVs would pull up with the symbol of your organization, and your driver would sit inside and wait for you or get out and talk to the other drivers. That was a bit of a luxury, but I don't drive stick. And you would walk across this gravel ground lots of rocks, and then you would go in and talk to all of the other agency representatives and understand how many potential cases there had been. Were people able to get to that particular part of the country? What was running out? What were the things that needed to be ordered or reordered? Were there any issues with getting like PPEs in from like the ports to like different parts of the country? There were flat screen TVs in there, projection screens as well. The connectivity was pretty good there. I mean, you couldn't not have it good there at the Ministry of Health. It had to be excellent there, because sometimes you were streaming in people in Washington or people in Atlanta or people in Geneva or New York. So the connection was pretty good there. But it was small. I mean, it wasn't really a place where you, it wasn't really a proper office. I mean, it was literally built to people for meetings. And I wish I could think of, I don't know if you know what those, what am I thinking? The types of cars that, those mobile vans, it was kind of like that, like a very large mobile building that was built that had two big rooms in it. And, that one big room, which was a conference room, had tables and chairs and flat screens. It was very simple, very basic. There were outlets, and then people were there for about an hour. Sometimes you would have meetings, and then you would leave. And you would come back the next day. So some people would stay longer to like discuss other things, other issues, but
yeah. So there'd be
pretty much what.
So there's like a central coordination authority, the health ministry, that was coordinating all of the response across all the different agencies that were participating. That's interesting.
Exactly.
Interesting concept.
Exactly.
And
that was run by the minister,
yeah.
The junior minister, who provided great leadership, Minister Tolbert, and he actually was a graduate from Johns Hopkins as well.
No kidding.
Yeah, very. He was a junior minister, but very well respected, had a lot of authority, very calming presence, and you almost see that. So it's very different. That kind of like incident command, emergency operating center is very different than, the command systems or command centers you've seen in the U.S. I mean, this was very basic, bare bones, that was built to be able to provide the necessities for the teams that were there. So this is, again, very different than what you would see in the U.S. with our very sophisticated systems here.
Mm-hmm. And then what would happen at the end of that meeting? Was there somebody who was kind of taking notes and would send out the, kind of recap of all the action items and the status to everybody, so everybody had kind of the document of what they had to do that day?
Exactly. That's exactly right.
All right.
That's exactly right.
Tell me a little bit about, you said that another element of your job, so then walk me through kind of like the rest of your day. So you go to this central incident command center, everybody gives their update, they get their marching orders, they hash things out, and then what's the rest of your day typically look like? What are you dealing with?
Yeah. What wasn't I dealing with? I mean, it ranged from, for example, maybe I would leave there and then I would go to the local large laboratory, LIBR, which was the main laboratory where all of the samples that were being done, all the testing that was being done was being examined at that hospital. So if there were potentially any backlogs, I would go there to understand what was happening and to be able to literally develop quick solutions to clear the bottlenecks, to clear any backlogs. That was being run pretty efficiently with the support of the Department of Defense, the U.S. Department of Defense. They created an operational system that made things so much more efficient once they were there. Before they were there was not the level of systematic organization that was necessary, that was efficient.
Yeah.
So that would be an example.
Yeah. Can you remember any examples of kind of roadblocks that they were facing, and maybe a solution that you helped to develop?
Sure. So, for example, there were times where there was not the ability to literally connect with other laboratories. And that would be literally due to telecommunication issues. So these laboratories were, and these specific laboratories that were identified were in different parts of the entire country, spaced out. And so there was another laboratory that was within a couple hours drive. And the connectivity was virtually non-existent for a period of time, for a short period of time, but it was still a critical time in the country. And so literally me and one of my tech network administrators and I drove out there to investigate and see what the issue was. And he literally climbed up a telephone pole. I was so nervous. I was thinking, oh my God, I cannot believe this guy is, but he literally climbed up a telephone pole to understand what was the issue. I mean, that's the kind of work that we had to do. And he literally people there are so brilliant. They figure things out. They are able to do anything given the opportunity. And he literally climbed up a telephone pole. I wish I had those pictures. I think I have them somewhere, but climbed up a telephone pole and rewired something. I would never know how to do that. I'm afraid of heights anyways. But this guy climbed up a telephone pole and fixed it right then and there. And we drove back the 2-hour drive, and that issue was solved.
Amazing. So taking decisive action and climbing poles when necessary. What? Okay, so
whatever it takes.
So then a day might include a visit to the testing lab. What other sorts of things might you be working on during a typical day?
Yeah, another example would be working with our counterparts at the Centers for Disease Control, the CDC. We would be discussing with them the disbursements of the funds and understanding where perhaps some of the funding should be focused on for the future. So, for example, if we realize that more information needed to be communicated to some of the healthcare workers, because one of the things that happened was a lot of, just like what's happening here, a lot of healthcare workers were getting sick. And so they wanted to increase infection prevention control measures and to really help communicate to the healthcare workers how to protect themselves. So there was investment there that was made to help do education and to also get better equipment available to the healthcare workers, whether they were the low-skilled healthcare workers or the more highly skilled healthcare workers in hospitals. So that, for example, we would have discussions on how best to do that and how best to quickly move funds to be able to do that.
Tell me
another example.
Yeah, so tell me about that. Like, how did you end up getting? So, what kind of equipment were you trying to get out there, and how did that actually work to get better? I'm assuming that you're talking about like personal protective equipment. How did you get that out into the field and get it to the right hands?
Right. So there are procurement systems that were in place to help make that happen. Whether items were being procured and then once they arrived, getting those items shipped or moved logistically from the ports to the different spaces that they were meant to be. That was something that those supply chains were created and improved. But what we helped do was reinforce that kind of training that was so necessary, that was so critical. CDC took the lead on that, and it was so important because they were the front line. They really needed to understand how best to protect themselves and to also stay as healthy as possible, but to also understand why, to understand how. And this was the other thing, we were time that the disease was spreading in different ways, just like we're learning in real time now that the disease was spreading in different ways. So they really took the lead on that, and they were amazing in ensuring that, but also helping develop literally marketing material. So like posters and billboards. Those things were to educate the workers, to help them understand how this disease was spreading and how to best prevent it, from help protect themselves from contracting it.
So in a place where you may not have TVs in every house and connectivity across the country, you were working to get billboards put up and marketing materials put up and, I don't know, flyers handed out across the whole country on how to protect yourself. And what were some of the communications to those healthcare workers about? Was it to wear a mask or gloves, or what sort of directions were you giving out?
Yeah, it was a consortium that was really taking the lead on doing that. But the different type of communication would be, how to wash your hands, ensuring to use the bleach and the bleach water. Your basic, I shouldn't say basic, but your infection prevention control measures, like creating protocols, making sure that those protocols were delivered to all healthcare workers and community health workers, so they understood what they needed to do to decrease the spread of the virus to themselves. Those were some of the instances. And then also some of the things that I got to work on was literally focusing on some of the logistics and the procurement aspects of things. So again,
tell me about that. Yeah, tell me about that. The logistics and procurement.
Yeah. So even running an EOC takes a lot of work. I had direct reports that were officially in charge of running those different EOCs. So someone had to be there to make sure that everything was literally open, to make sure that connectivity was in place across the different EOCs so that they would all literally connect and be turned on at the same time. So from the capital, Monrovia, where the Ministry of Health was, and then to the other 15 EOCs that were placed strategically around the country, there was a team member that was there at the same time, making sure that all the TVs synced up and were connected so that you could hear what was happening in the first state, the second state, and throughout all of the 16 states, which had 16 EOCs total across the country. Making sure that because there, isn't as the level of connectivity that we have here in the U.S., a lot of things are powered through, they're not just powered through having normal light, like as a public utility. So you have to have generators everywhere. And in order to have generators everywhere, you need to ensure that they're filled with petrol, and then you have to keep them running. So literally even getting petrol to all of the EOCs on a regular basis so that the generators would work to run to keep the lights on. I mean, everything you can think of running an office, that kind of work fell under that logistics and procurement and operational work under that little pillar of work.
Tell me some of the crises that came up. There must have been, ones almost every day. I'm curious to hear some of the things that you had to overcome.
Yeah, that's a great question. So, for example, I remember when I first got there and we had people in quarantine, they had to be quarantined for 21 days because they had been contact traced and they'd been exposed, and we had to see if they were going to develop the virus. And I was going to check in on them, and just learning that, people are living in different areas around the world, and knowing that because they're quarantined, you have to provide for them, or at least that's what the government was doing, which was great. So the people that were literally under enforced quarantine, after they had been contact traced, you have to bring them food on a regular basis. So that was being done, and getting to understand some of the choices of the people that were angry due to being under quarantine. Understanding and listening to them and talk to them about their frustrations that was really eye-opening as well. And then also getting to understand the environment that they were currently living in. Again, this was like areas that are outside of the city, the main city. And so people live a very different type of life. There's no running potable water, for example. So the clean water supply is through it's provided through a large, essentially a very large tank that's put inside of these communities that people can go and fill up a container so that they have fresh water for the day or for the week. And if you're under quarantine, you don't have access to that. So really trying to understand what some of those challenges were for those people and writing that up and saying, all right, we have to provide for them. We have to figure out how to make sure that they stay under the quarantine and get them what they need. So
and how would you
some of the
and how would you personally protect yourself? What equipment were you wearing when you went in to chat with people?
So I didn't wear full out PPEs, including like the plastic material and the gowns. I only did that when there was like a very specific case that was identified, and in order to get there, you had to step into like a bucket of bleach, essentially, and rinse your hands with bleach water, and you have to go through 3 inner rings of that to like get even into the most inner ring of a patient that had Ebola. But in the villages that were being contact traced, you had to rinse your hands with bleach and wipe down your shoes with bleach. And I would wear these like very thick-soled hiking boots that were very waterproof. And you would spray, and then from there I would be able to. I had protective goggles, and that was it. I didn't get in the range of being next to someone that was being contact traced, if you will. I mean, I had at least 12 feet in between me and anyone that was being contact traced, and so I was able to have dialogue with them from afar, if you will.
Mm-hmm. Mm-hmm. Wow. Okay. What were some of the things that just surprised you about this whole experience, or what were some surprises for you?
Yeah. So I would say that one of the things that really surprised me was how the country of Liberia in particular, how it was, I would say, I always had an impression in my mind of what it was like. It was very different from when I arrived there. Liberia is a very interesting country, just culturally and historically. It's the only country in the entire continent of Africa that wasn't colonized. And it had just, I shouldn't say just, but not even 12 years before, it had seen the end of a long-standing civil war. And I remembered hearing about the Civil War and seeing some of the images when I was much younger. But what I was surprised to see and hear about was that people talked about the Civil War as if it was yesterday. So I really, in some ways, felt that the country hadn't really recovered from that Civil War that waged from the 90s into the early 2000s, mid 2000s. And then you have this disease that sweeps through in end of 2013, 2014, 2015, 2016. And so there wasn't enough period of recovery from the Civil War that killed so many people, that devastated the economy, that generations of people didn't even get a chance to go to school because they were hiding, they were at home. It was so dangerous to be in that type of a war zone. So life stood still. And that's what it felt like in many ways during that time as well, that life was standing still. So there were periods of time I remember seeing even before I got there, when I was still in Nigeria, I remember seeing that there was this one particular area called West Point, and it's a slum in the capital, Monrovia, that borders the Atlantic. And I will never forget in my hotel watching on TV that they were enforcing a quarantine in this entire area. And that's where the majority of Liberians lived, in the capital. And I just thought, my goodness, they're doing what you did like centuries ago to prevent a disease. And I just thought, wow, this is amazing that that's what's happening. And that was in 2014. I was thinking that. And here we are in 2020, and I'm sequestered at home in my Brooklyn apartment in quarantine. So you can imagine like how discombobulating that is right now.
Yeah, absolutely. What were some things that might have been different? You have a master's in public health from probably the top, public health school in the country, or at least one of the top, Johns Hopkins, right? What were some of the differences between the theory that you learned in school and when you went to apply it in real life of what it actually takes to battle a pandemic?
That's a really great question. I would say that what's so important is when you're in school, everything for the most part that you're learning is in many ways theory, right? It's theory or it's history, and you're learning from things in the past. And so your ability to be able to apply it in real time is important with the current context. So there's some great courses that I took that really helped me with being able to understand, okay, there are certain things that you have to understand that take priority, that really need to be focused on first. So whether you're working in a setting or you're working in a setting that's transitioning from emergency to transition setting, to quote, back to normal, if you will. And I think that was something that I valued about my training, my education, being able to understand that, yes, at the end of the day, you've been trained well, but you also have to really rely on your own personal training, your understanding, and your just critical thinking skills and the current context of your environment, because it's just going to always be different.
Yeah. What's a myth or a misconception about working on a pandemic that you can challenge for us?
Well, I would say that one of the things I think is important is remaining calm. I think that one of the challenges that we had during that time was, and what I'm seeing now is the miscommunication that happened initially. I think that that's something that, unfortunately, I'm trying to say this in the nicest way, but that time wasted could equal lost lives, right? So I think one of the things that was really important is to understand and assess that situation and understand the importance and the graveness of the situation and act swiftly. And that takes very strong leadership, and that takes clear understanding and decisiveness, and having a good team around you to understand, these are the calculated risks we're going to have to take, and knowing that you made the right decision. So, and at the end, knowing that you won't really know what the right decision is, but you have to make it fast. I think that's something that's really important.
Well, you demonstrated some incredible improvisational ability and get it done, whether it's getting diesel fuel to the right place to run the generators or fixing the telecom situation. Maybe things that they didn't teach at Johns Hopkins but are critical to public health. Olivia, where We could just go on for hours. I'd be, fascinated to keep hearing about this. See, we're at the top of the hour. Where can people who wanted to, catch up with you or learn more about your work today, working with corporate clients, where can people find you online?
Yeah, well, I'm on LinkedIn, Olivia Chioma Elee. I'm on LinkedIn, so always happy to connect and share more about some of the great lessons learned, and also just in terms of, the work that I'm doing now, focused on strategy and operations and customer experience. I think that in particular now, as the way we live and do business, it's going to change so much since COVID-19 here in the U.S. And it's just I think the businesses that are going to really stand out are going to really have the customer in mind and being able to, focus on them and what their needs are. So I always love discussing that, thinking about that, and applying those different lessons learned. So I'm on LinkedIn. It's probably the easiest way to reach me. Also, my email is oliviacelee@gmail.com.
Fantastic. And we will include your LinkedIn profile link in the show notes. Olivia, your experience batting Ebola gives you this amazing perspective on how companies should be thinking about coronavirus today. Thanks for sharing some of your stories. I really appreciate having you a guest on the show. Thank you.
Thank you so much, Will. This has been such a pleasure, and I hope you and your family stay safe, and we'll all come out of this sooner or later stronger.
I think so too.
Thanks for the opportunity.
All right. Bye-bye.